Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. It is, March 11, 2025. Our patient presents with two problems, two sources of back pain. The first is annular tear in L5S1, along with a herniation and spondylolisthesis with compression of the right L5 nerve root with severe compression. The second problem is a torn piriformis muscle. Now we've just fixed his disc. Now we're going to fix the piriformis muscle on the right. The problem with the piriformis muscle is it's torn. And once it tears, it just never heals. So it just causes pain. And most people go to therapy or they're sent by their doctor to physical therapy. But physical therapy will never fix the problem. I can wait. So as a matter of fact, the only way that we found that's successful to get rid of piriformis pain is actually by doing what's called a piriformis muscle release shot. And I'm going to show you. Do you guys see, Jordan, show the audience where the tip of our probe is. See that tip right there? Now,
Yes,
that tip is touching a bone at the back of the femur, and that bone is called the greater trochanter. Specifically, the greater trochanter has 4 parts, 4 regions, and the region we're touching is the posterior superior facet and the posterior facet. Now, just medial to this is called the piriformis fossa, and that's where the piriformis muscle attaches. And the only treatment that works for this piriformis syndrome that we found to work is to release the connections of the muscle to the top of the hip, and in doing so, it allows the muscle to heal properly, and it takes away the pain immediately. Yeah. So that's what we're doing. And I developed and pioneered this technique. Now, the concept of piriformis release is not new. It's been done for a long time by orthopedic surgeons usually, and they go down by the pelvis and release the muscle. Almost done. 10 seconds. But the fact is that the way the orthopedic surgeons do this release is bloody and painful. It's horrible. You never want it done. You can hear the sounds of the fibers being cut. All right, we're done. Let's show the audience how piriformis muscles can become so painful and how we fix them now.
Of course.
By the way, you can see the incision is 4 millimeters.
We can see it.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
All right, and that was the how to cure piriformis pain. And then now we would like to show you guys our latest trailer of the movie Spine Scam that we are going to be doing a live screening of on Sunday, March 16th at 1 p.m. Pacific Standard, 4 p.m. Eastern Standard via Zoom. I will put the link in the chat. So please, if you want to join us and give us your insight on the movie, please welcome to do so. So here it is playing Spine Scam.
Allegations have surfaced pointing to a major bribery scheme between medical providers and spinal surgeons. What we uncovered is potentially criminal.
This consulting package is worth $300,000 to $500,000 a year.
You know how this works. You lie to people in pain to make a buck. And I give you tropical vacations and pleasure cruises to make it worth your while.
Your fusion technique is looking very good. You stay focused and disciplined, you'll go a long way in this business.
And I'd like to thank my friends Bruce and Red at Globazon for helping to develop these exceptional products.
I wonder how much that fucker makes from those implant companies.
You think he's on the take?
You know he is.
We need every one of our residents to be loyal to the program and loyal to the Globazon brand.
There's a new aspiring neuro at SD University Hospital. I want you to move in and land him.
And how far do you want me to go?
Whatever it takes.
You have lumbar degenerative disc disease. Spinal fusion is the only option.
Lately, I've noticed the hospital seems to be doing way too many surgeries. Like we're doing it just for the money, not because it's 100% the right call for the patient.
Your little prodigy's become obsessed with some sort of alternative laser treatment.
It's better for the patients.
For your own fucking good, drop it.
I feel like they're all pushing me to do what's best for them, not necessarily what's best for me.
Why can't anyone just do the right thing?
We do not need some morally virtuous renegade poking around. This could become a complete shit show.
What about our pledge to the industry?
What about the welfare of our patients? What about our own moral code?
And if he doesn't listen, then cut him loose. Hey, remember when that douchebag Dr. Bob used to be an idealist? Now he's just a capitalist.
Capitalists like money.
Yes, they do.